Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Adrenal function test and hypertension. When you look at hypertension, you want to believe that hypertension is just a one factor cause. That is, you can only say this is the cause, but it's not true. Hypertension has two main types, that is the primary hypertension and secondary hypertension. The secondary hypertension is not that wide in the number of people having it. You find that around 10% to 20% usually have this secondary hypertension. The primary hypertension, the cause is multifactorial. You can talk of the genetic, that is the family makeup, the age. You can talk of diet, the lifestyle, and so many things causing it. But the secondary hypertension has a condition, and it could be this adrenal. The adrenal plays a very important role in the management of the our homeostasis, that is our being calm and normal, or when we are stressed, when we start behaving in an unusual way, full of anxieties, and these are what usually creates that hypertension that we experience. The hypertension acts the problem of leading to various complications of like stroke, like heart disease, and you may even had serious kidney problem, failure. So when you are talking of adrenal function test, you are more or less trying to know the cause of the hypertension, whether it could be or hypertension could come as a result of this adrenal dysfunction. The adrenal function test is one of the tests that the medical laboratory scientists will usually do. It's an hormonal test that will always be asked to do, where you really want to find the cause of high blood pressure that anybody experience. The adrenal function test in the main has about 3 or more hormonal tests that you are expected to do. The cortisol test, the ACTH test, the aldosterone test, and even the DHEAS test that would help diagnose the cause of whatever experience you are having, especially when it concerns the high blood pressure. The full detail of the adrenal gland, its function, is what the adrenal function test wants to uncover. That is, how healthy is the adrenal gland. So when we want to do adrenal function test, it is usually done probably in a situation of where somebody is having high blood pressure, is hypertensive, and you want to know whether the cause is a dysfunction of the adrenal gland. The values that the various hormones produced by this adrenal gland is noted. Once there is a derangement in value, you now want to suspect that it is the cause of that hypertension or any other disease experienced by the patient that is aligned to that level of production. More exposition, I shall expose more as we go into the slide session, and as usual, click the like button, subscribe, so that you may have a detailed information. The outline, objective, introduction, symptoms, indicator for test, laboratory diagnosis, and finally treatments. The objective: to create more awareness of symptoms indicators for adrenal function test, thereby reducing the prevalence of secondary hypertension among the people. especially those in the developing countries of the world. The introduction. Hormonal or endocrine hypertension belongs to the group of secondary forms of hypertension and is mostly caused by disorders of the adrenal gland. The adrenal gland is what you have seen and showing vital side. There are also non-adrenal endocrine conditions that can lead to hypertension secondary to hormonal imbalance. The adrenal gland consists of two parts as shown in the diagram: the adrenal cortex and the adrenal medulla. The adrenal cortex produces hormones such as cortisol, aldosterone, and sex hormone, while the adrenal medulla produces the adrenaline and norepinephrine. Adrenal function tests are medical assessments used to evaluate the health and functions of the adrenal gland. The adrenal glands, located on top of each kidney, play a vital role in producing hormones that regulate various bodily functions, including metabolism, stress response, blood pressure, and electrolyte balance. Here, the picture shows the adrenal gland and the inside of the adrenal, which is the medulla. The topmost is the adrenal cortex. Now to the indicator for this test to be done. According to WHO, 1.4 billion adults aged 30 to 79 years worldwide had hypertension in 2024. These represent 3% of the population in this age range. And also, 5 to 15% are secondary hypertension of the total population. It is therefore necessary to know the symptoms indicator for adrenal function testing. You may have a situation where you have the adrenal incidentaloma, that is finding a mass on an adrenal gland. That is during imaging when you do the scan. Then if you experience sleep apnea, obstructive sleep, is strongly linked to this adrenal aldosterone. And early onsets of hypertension between the age of 30 and 40 is indicative that one should check for these tests, the early onset. There is also resistance hypertension, when you experience that you are using up to 3-4 drugs for your hypertension. You may need to check for this. So there are also many indicators. Even the arterial fibrillation is another one, and so on and so forth. The laboratory diagnosis. Sample collection. You can collect blood or urine, and the various tests that can be done is the aldosterone test, the cortisol, the ACT simulation test, and the DHE, which measures the level of the hydroepiandrosterone sulfate, a precursor to sex hormone. So abnormal DHEAS levels may indicate adrenal dysfunction too. Yeah, more tests. A morning results, serum cortisol greater than 5 grams per deciliter is diagnostic of Cushing's syndrome. So that helps in reducing such a disease. Morning aldosterone of that is greater than 15 nanogram per ml with an aldosterone to renin ratio of greater than that is indicative of Cushing's syndrome. That's serious hyperaldosteronemia causing serious hypertension. Angiotensin is also responsible for high blood pressure. So overproduction of renin substrate, angiotensinogen, could also be studied. Finally, treatment. Medication. You have so many drugs. One of them is spironolactone, can help block the hormonal effect of aldosterone, and one is free from that hypertension. Surgery, where MRI is done, then they can remove that tumor on the adrenal gland. There is also the checking for nodules, which is a recent discovery. The nodules, once they are size removed, especially if the size of the nodule is more than certain centimeter, when it is removed, it's a cure on its own. And the nodules could come at any age, even very old age, over 70 years. The cure is permanent with no more hypertension drug treatment. So check more of my video in this channel. There are so many videos, counting over 212. Thank you.